Hi, my name is Tom Faerber. I'm a board-certified oral and maxillofacial surgeon. I've practiced in Overland Park, Kansas for 32 years. And today Glenn came in and we are discussing an issue he had previously. He had a fractured lower left tooth, which was severely infected. We took the tooth out and then did some reconstructive bone grafting, let that heal for 4 or 5 months, eventually went back and did a dental implant. And Glenn, I just wanted to ask you how you felt the procedure went as far as each step.
Yeah, so as you know, I was in a lot of pain when I came in,
yeah.
and it was a kind of a mystery. I'd already gone and actually had an endodontist look at it, and they said, well, they didn't think that it was anything, and that it would go away, and it didn't go away. It got actually worse. So you suggested actually taking the tooth out, which was very smart, and obviously replacing it. But once I did that, I can't tell you, like I've never had that much pain before, and to actually have that pain completely gone, as soon as you took that tooth out was amazing. So, and then of course having the actual implant put in, I think you did, your staff, everybody did a great job, and very caring. Talked to me every step of the way. When you were actually doing the procedure, you were actually explaining each step in the process, which made me feel comfortable, because it's, whenever you have a tooth extracted and you're doing all that work, there's a lot going on in there.
Right.
And you can feel it, you can hear it, but when you're actually explaining as you go, it made it more comfortable for me to have it done.
Well, great. We appreciate that. And it's, everyone's different when they go through these procedures, and it is an area of high nervous input,
right.
So it can be pretty sensitive. How did you do when we got the tooth out? And then also, when we did the implant surgery, how was the pain level after those two procedures? So
again, the implant piece of it, I didn't really have. I had just, I think you called it, it was called like a ghosting pain.
Mm-hmm. Yeah.
When I first had it done, and I'm like, oh boy, this is hurting again. And it literally went away in a couple hours, which was kind of strange. But it just, I think it was the fact that something was actually touching that area, and it my nerves or whatever, it reacted to it. Mm-hmm. But once that was done, no pain at all. I mean, I literally didn't have any pain. I think I never took pain medicine. I took Advil, the first time, and that was it.
Yeah.
So
you didn't have to take the hydrocodone at all. That's great. Yeah.
No. So felt really good about that. But overall, I mean, like I said, it was almost night and day when you took the tooth out and then did the implant. I literally didn't have any pain after that. So.
Yeah. And then I think we did a third procedure where we did the exposure of the implant. Did you tolerate that okay?
Tolerated it fine. I didn't even, I didn't really even feel it. I think you numbed me up, obviously, when you did it, but afterwards I didn't have any pain afterwards at all. So the pain management piece was really big for me, because like I said, I've never had that much pain in my mouth before.
Right.
And having that completely taken away, it really made a big difference.
And we did both of yours just under local anesthesia, didn't we?
Correct.
And that went okay for you?
It did. Yeah. And again, the process where your staff explaining each part of the procedure, and then when you came in, it made it more comfortable for me.
Yeah.
So.
Yeah. Good. Well, I'm happy you got through it, and look forward to you getting the crown on.
I am too. I'm looking forward to my final piece.
Yeah. Okay. Great. Thanks for coming in.
Thank you.
All right.